Sandra.
Hi.
My name is Claire, and I'm going to be conducting a neurological evaluation on you today.
Okay.
So to get started, I just wanted to ask you a few questions about your personal, family, and medical history.
Okay. So I had a fall last week, and I was in a car accident, so I've been having, some tremors in my body, and some headaches, and, kind of like migraines.
Okay.
Mm-hmm.
Do you have any personal or family history of any neurological conditions?
Mm-hmm. Other than the car accident, no.
Okay.
But my father has a brain injury from a fall.
Mm-hmm. Okay. Would you mind telling me a little bit about your work and day-to-day activities?
So I work in a hospital, so I'm pretty active, always on my feet. But other than that, that's about it. I like to go to the gym and stay active.
Have these changes in the headaches been affecting any of these things for you day to day?
I would say yeah. Working in a hospital and things like that.
Okay. So first we're going to start with a mental status exam.
Okay.
So this is just going to assess your attention, memory, some orientation, language, and reasoning.
Okay.
Are you ready? Okay. So first, I'm going to have you to draw a line going from a number to a letter in ascending order.
Okay.
So from 1 to A to 2 and so on until you end up at E.
Okay. Okay.
Do you see this drawing? Copy it as accurately as you can in this space below.
Okay.
Okay. Now I'm going to have you draw a clock with all of the numbers and set the time to 10 past 11.
Okay.
Great. What is this animal?
A lion.
What is this animal?
Rhino.
What is this animal?
Camel.
Great. So this is a memory test. I'm going to read you a list of words that you'll have to remember now and later on.
Okay.
Listen carefully, and when I am through, tell me as many of the words as you can remember in whatever order.
Okay.
Face, velvet, church, daisy, red.
Face, velvet, church, daisy, red.
Now I'm going to read this list one more time. Try to remember and tell me as many of the words as you can, including ones that you have said before.
Okay.
Face, velvet, church, daisy, red.
Face, velvet, church, daisy, red.
Great. Now I'm going to tell you some numbers, and when I am through, repeat them to me exactly as I have said them.
Okay.
2, 1, 8, 5, 4.
2, 1, 8, 5, 4.
Great. Now I'm going to say some more numbers, and this time when I am through, repeat them to me in backwards order.
Okay.
7, 4, 2.
2, 4, 7.
Okay. Now I'm going to read a sequence of letters.
Mm-hmm.
Every time I say the letter A, tap your hand like this.
Okay.
If I say another letter, do not tap your hand.
Okay.
F, B, A, C, M, N, A, J, K, L, B, A, F, A, K, D, E, A, J, A, M, O, F, A, B. Okay. Now I'm going to ask you to count by subtracting 7 from 100.
Okay.
Then keep subtracting 7 from your answer until I tell you to stop.
Okay. 93, 86, 79, 72, and 65.
Stop.
Okay.
Now I'm going to read you a sentence. Repeat it after me exactly as I say it.
Okay.
I only know that John is the one to help today.
I only know that John is the one to help today.
Now I'm going to read you another sentence and repeat it back to me exactly as I say.
Okay.
The cat always hid under the couch when dogs were in the room.
The cat always hid under the couch when dogs were in the room.
Now I'm going to have you tell me as many words as you can think of that begin with a certain letter I will say in a moment.
Okay.
You can say any kind of word you want except for proper nouns like Bob or Boston, numbers or words that begin with the same sound but have a different suffix like love, lover, or loving.
Okay.
I will tell you to stop after 1 minute.
Okay.
Are you ready?
Mm-hmm.
Tell me as many words as you can that begin with the letter F.
Face, falcon, forest, fort, fairy, fun, friend, furry, farm, fume, famous, facts, fork, can't think of any more.
That's okay, we have about 10 more seconds. Okay, stop.
Okay.
Great. Can you tell me how an orange and a banana are alike?
They are both fruit.
Okay, how about a train and a bicycle?
They're both used for transportation.
And how are a watch and a ruler alike?
Use them both to measure.
Okay. I read some words to you earlier and asked you to remember them. Tell me as many of those words as you can remember.
Church, face, daisy, red, velvet.
Okay. Can you tell me the date today?
Today is March 5th, Tuesday, 2019.
Okay. Can you tell me the name of this place and which city we are in?
We are in the University of Maryland Hearing and Speech Clinic in College Park, Maryland.
Great. So, for normal findings on the MOCA, a score of 26 or above would indicate normal cognitive functioning, and then a score below 26 would be indicative of mild cognitive impairment and maybe a condition such as dementia or Alzheimer's disease. So, next I'm going to conduct a cranial nerve exam on you just to see how the nerves in your body are working.
Okay.
So first, I'm going to have you smell some smells. So
Okay.
I'm going to have you cover one nostril like this and close your eyes. So let me know if you smell it and then try to identify what that smell is.
Orange.
Great. Now let's do the same thing, clean Q-tip in the other nostril.
Lemon.
Great. So we just did a test on the olfactory nerve, which is the sensory nerve for smell. So normal findings would be that they could indicate that there was a presence of the smell and also be able to identify what that smell is. Abnormal findings would be anosmia, so an absence of the sense of smell, and then obviously they wouldn't be able to identify what the smells were that you presented to them. So next, I'm going to have you hold this paper about 14 inches from your face, cover one eye, and try to read the lowest line of letters that you can.
Okay. V, L, T, D, N, E.
Great. Now let's try the same thing, covering the other eye.
V, L, T, D, N, E.
Great. Now I'm going to have you look straight ahead at me, cover one eye, and then I'm going to have you tell me how many fingers I'm holding up.
2, 1, 1, 2.
Great. Let's try the same thing with the other eye covered.
2, 1, 1, 1.
Great. So we just tested the optic nerve. First we tested visual acuity, and normal visual acuity would be 20/20 vision. And then we also tested Sandra's vision in all 4 visual fields. So normal findings would be that they would correctly be able to identify the number of fingers you were holding up in all 4 visual fields. Some abnormal findings could be lowered visual acuity, which could be resultant of damage to the optic nerve. Also, if someone had a unilateral lesion to the left optic nerve, for example, they would not be able to see and would have unilateral blindness in their upper and lower left visual fields. And then if someone could not see in the lateral fields of both of their eyes, then we would know that they would have bitemporal hemianopia. Okay, so next I'm going to shine a light into your eye. Try to hold your eye open. And I'll do the other eye. So we just tested Sandra's pupillary reflex. So normal findings would be normal constriction of the pupil. And then some abnormal findings could be if there was direct constriction, they would have a unilateral lesion. If there was concentric constriction, they would have a contralateral lesion. Now I'm going to have you follow my finger with your eyes. So we just tested the abducens nerve, the trochlear nerve, and the oculomotor nerve. So normal findings would be that they would be able to follow your finger with their eyes laterally, up and down, infranasally, and then all other eye movements. And then abnormal findings could be if they had damage to the abducens, they would not be able to move their eyes laterally from side to side. If they could not move their eyes infranasally, they could have damage or a lesion to the trochlear nerve. And then if they had difficulty with any other eye movements, they could have damage or a deficit with the oculomotor nerve. So now I'm going to touch your face with something soft, a clean Q-tip, and something sharp, a push pin. Would you like to feel? So this is something soft, and this is something sharp.
Okay.
Where did you feel that?
Forehead.
Okay.
Cheek. Jaw. Forehead. Cheek. Jaw.
Great. So we just tested the sensory portion of the trigeminal nerve. So we're looking for the patient's ability to localize both sharp and soft touch or sensation in the upper, middle, and lower face. Abnormal findings could be damage to the sensory portion of the trigeminal nerve, resulting in the patient's inability to sense touch in their upper, middle, or lower face. Okay, now I'm going to put this glove on. Gonna have you bite down hard for me. Great. Then I'm going to have you open up your mouth. I'm gonna try to close it. Don't let me. Now close your mouth. I'm gonna try to open it. Don't let me. Now push your jaw to the side. I'm gonna try to push it in. Don't let me. And then open your mouth slightly like this. And then I'm going to strike my finger with the hammer. Great. So we were looking for the motor portion of the trigeminal nerve, so the muscles of mastication, there should be symmetry and range of motion. And then we were also looking at the jaw jerk reflex. Normal findings would be absence of a jaw jerk. Some abnormal findings could be if there was a jaw jerk when I struck the hammer close to Sandra's mouth while it was open a little bit. That could be indicative of an upper motor neuron lesion. And then also, if her jaw had deviated to the side when I tried to close her mouth, that could indicate damage to the pterygoids. Okay, Now I'm going to have you wrinkle your forehead, close your eyes tight, show me your teeth, purse your lips. Great. Now I'm going to have you stick your tongue out, and with a clean Q-tip, I'm going to present a taste to you. Don't let your tongue go back in your mouth until you know what you've tasted.
Salty.
Great. Okay, now with a clean Q-tip, let's do the same thing on the other side. Don't put your tongue in until you know what you've tasted.
Sugar.
Great. So we just tested the sensory portion of the facial nerve, so Sanders, and the motor portion. So the motor would be Sanders' ability to move the muscles of her face for facial expression. So normal findings would be that she could do all these movements normally, and then also the sensory portion is for the anterior 2/3 of taste for the tongue. So normal findings would be that you'd be able to identify the differences between, for example, a salty and a sweet taste. And then abnormal findings could be if, for example, they had weakness with the orbicularis oculi muscle, they wouldn't be able to close their eyes tight. And then also if they were unable to taste, we would think that they may have some damage to the sensory portion of the facial nerve. Okay. Now I'm going to have you close your eyes and let me know which ear you hear the sound in.
This one.
Okay.
This one.
Now I am going to present a tuning fork in the middle of your head,
Mm-hmm.
and I want you to let me know if you hear it stronger on one side.
Okay. The same.
Okay. Now I'm going to have you look at this pen and keep your eyes fixed on it. Move your head up like this, down, to the side, and to the other side. Okay, great. So we just tested the vestibulocochlear nerve, bone conduction with the rustling of the fingers, or air conduction with the rustling of the fingers, bone conduction with the tuning fork. And then we also tested the vestibulo-ocular reflex to see if the patient can keep their eyes fixed on an object in front of them while moving their head. So normal findings would be the ability to localize the sound in an ear, not feeling the tuning fork sound or vibration stronger on one side of the head, and then also the ability to keep your eyes fixed. Then some abnormal findings would be if they could not localize the sound with the rustling of the fingers, they may have hearing loss and air conduction. If they had the sound and vibration of the tuning fork louder in one side of the head, they may have some bone conduction deficits in their hearing. And then also, if they cannot keep their eyes fixed on an object and move their head around, then they do not have the vestibulo-ocular reflex. Okay. Now I want you to open your mouth and say, ah.
Ah.
And now, ka.
Ka.
Okay, great. Now, I'm going to have you stick your tongue out, and I want you to, I'm going to push against it, and don't let me push it back in your mouth. Okay, so, we just tested the glossopharyngeal and the vagus nerves. Also, something else that you can test for these nerves would be the presence of a gag reflex. So you could take a clean tongue depressor, stick it in the back of their throat, and see if they have the presence of a gag reflex. But you must keep in mind that not everyone has a gag reflex, so you can't use this for diagnosis of any type of deficit. So normal findings would be that the palate would be elevated and that there would be no nasal emission. Some abnormal findings could be if the uvula deviates to the normal side, there could be unilateral weakness. And then also if the palate does not elevate on both sides and there is audible nasal emission, they could have bilateral deficits. Okay. The next thing that I'm going to have you do is shrug your shoulders And then I'm going to have you turn your head to the side. I'm going to try to push it in, don't let me. And now the other side. I'm going to try to push it to the middle, don't let me. So we just tested the accessory nerve, which is responsible for the neck musculature. So normal findings would be that they would be able to resist my pressure when I try to turn their head back, and also be able to shrug their shoulders with a full symmetrical range of motion. And then some abnormal findings for the accessory nerve could be weakness of muscles such as the trapezius or sternocleidomastoid in the neck region. Okay, now I'm going to have you stick your tongue out and move it side to side. Then push it out. Don't let me push it back in. Okay, so we just tested the hypoglossal nerve, which is the nerve for tongue movements. So normal findings would be normal movement of the tongue and being able to stick it out straight and keep it stuck out while I provide resistance. Some abnormal findings could be atrophy of the tongue, observing fasciculations, and then also if the tongue deviates to the weak side when it is pushed out, that could be indicative of unilateral weakness for the hypoglossal nerve. Okay, so next we're going to do a coordination exam. So I want you to say lepica, lepica, lepica as fast as you can.
Lepica, 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 lepica.
Okay. So now I'm going to hold my finger out and have you take your pointer finger from your nose to my finger. Now one more time. Great. So with the coordination exam, we're testing coordination of movements of the palate, the tongue, the lips, and the cerebellum. So normal findings would be normal coordinated movements of these. And then abnormal findings could be something like dysmetria, which is deficits with the cerebellum, and that would be when the patient would over or undershoot when you ask them to go take their pointer finger from their nose to your finger. Okay. Now I'm going to flex and extend your elbow. Just relax. Now I'll do the other side. Now I'm going to flex and extend your knee. Great, and the other side. Okay, so we just tested the muscle tone in her upper and lower extremities. So normal findings would be normal muscle tone and range of motion. Some abnormal findings could be hyper or hypotonia, also spasticity, which is variable resistance, and then rigidity, which is consistent resistance. Okay, now I'm going to test your strength, so I'm going to have you flex your arm hard, and I'm going to try to pull it down, don't let me. Okay, then extend. I'm going to try to push it up, don't let me. Okay, now I'll do the same thing on the other side, so flex. I'm going to try to pull it down, don't let me. And then I'm going to have you extend, and I'm going to try to push it up, don't let me. Great. So we rate patient strength on a scale of 0 to 5, 0 being no contraction. This would be normal finding, and then abnormal finding could be up to a score of 5, which includes constant contraction when you're manipulating the individual's extremities. Okay. So now I'm going to have you hold your arm out for me, close your eyes, and I'm going to present a sharp feeling object and a dull feeling object, and okay. I want you to indicate which one you felt.
Okay. Soft.
Okay.
Dull.
Okay. Now let me try the same thing with the other hand.
Soft. Sharp.
Great. Now I'm going to have you close your eyes and hold your hand out, and I'm going to push your thumb up or down, and I want you to indicate which direction I pushed your thumb.
Okay. Up, down,
Great. Let's try the other hand.
Up, down.
Great. Next, I'm going to have you hold your hand out for me, and then I'm going to have you close your eyes, place an object in your hand, and I want you to identify what that object is.
Okay. Pencil.
Okay, now let's try the same thing with the other hand.
Phone.
Great. Okay, now finally, I want you to hold your palm out, and I'm going to trace either a letter or a number, and I want you to let me know what that letter or number is.
Okay. N.
Okay?
4.
Great. Okay. So, we just tested the sensory exam on Sandra. So basically normal findings would be that they could indicate the difference between dull and sharp objects' feelings without looking. And then also they would have normal position sense, so she would be able to tell when I pushed her thumb up or down. And also there's the presence of stereognosia, which basically just means that the individual can identify a normal object by feeling. And then finally, the presence of graphesthesia, which means that the individual can successfully identify a letter or number when you trace it on their palm. And then abnormal findings would be the inability to differentiate between sharp and soft touch, the absence of stereognosia and graphesthesia, difficulty with position sense, so not knowing when you push their thumb up or down, and then finally, if they have any report of pain sensations that are abnormal, such as pins and needles. Okay, so we're all done for the day, Sandra. Did you have any questions for me?
Nope.
Great, thank you.
Thanks.